patients. I give the floor to Dr. Zhang. Among the 260 imported cases, we have 74 picked up at the airport, 109 cases at quarantine hotels, and 31 identified after they've left quarantine hotels. These 216 cases came from 48 places. 5 have imported more than 10 cases. 60 from UK, 19 from Singapore, 19 from US, 13 from the Philippines, and 11 from Australia. And for the remaining places, they've imported less than 10 cases respectively. We've got 3 elderly care homes and 1 care and attention home and 1 home for the disabled with cases. Songdak Elderly Care Homes has got 1 resident confirmed and also 4 residents under quarantine. And in Yunnan, another 1 resident confirmed. Yao Oi Elderly Home at Tuen Mun, 1 resident. Yan Chai Care and Attention Home, 1 resident and 1 staffer confirmed. United Christian Hospital, Sao Mau Ping Activity Center, home, 1, and also Bolan Guk Jiang Yikzi, 1 employee confirmed. We've got 258 schools reporting 323 positive cases to us. 263 of them are students and 60 are staff members. There are 58 kindergartens, 122 primary schools, 76 secondary schools, and also a few special schools. In the past week, 148 schools reported more than 2 cases or above to us in the same school. We have suggested that following schools have some of their classes suspended for 1 week, including Yunnan Gigwood Kindergarten, K24B, 23 students confirmed. This class should be suspended for 1 week. In Central Western Catholic Diocesan School, and in class 3C, 20 students confirmed. It should be suspended for 1 week. Salvation Army 中原慈善基金皇后山學校 in Fanling, in 3 out of 23 students confirmed in class 3B. So classes should be suspended for 1 week. Another school, Kowloon Tong, Norfolk Road, kindergarten, a few drivers of school buses and nannies, 7 drivers and 1 nanny confirmed. Sometimes they ate together. Well, they were drivers of school buses. In one of the school buses, 1 nanny, 1 driver, and also 2 students confirmed. And in this school bus, there are a total of 26 students. For the PM session, 26 students. They have to be suspended from school for 1 week, and there are 4 confirmed cases on this school bus in total. For subvariant cases, we have got 38 suspected BA.2.12.1, and 19 were linked, and also the remaining are untraceable. And for BA.4.5, 20 suspected cases, 8 are linked to other cases, and 12 untraceable. That's all from me today. Thank you. Well, yesterday, we reported in a palliative care ward of Buddha's Hospital, we have got 1 82-year-old female student patient confirmed. She's in stable condition and being isolated. So far, 5 patients and 5 staff members are confirmed in this ward. In an orthopedic ward of QEH, a 98 patient was confirmed on the 14th of July. Upon contact tracing, all patients and staff members of the ward were tested. It was found that 3 patients in the same ward tested positive. They're in stable condition and receiving isolation treatment. The ward has stopped admitting new patients and also visitors. We have thoroughly disinfected the place and will closely monitor the health conditions of patients and staff. We will liaise with the CHP to update them on the situation. And for QEH, in radio diagnostic department, there were some cases. Today, one more doctor was confirmed. The case is a close contact of an earlier confirmed case. During the period, the doctor was away from duty and isolated at home. And the work of the department has not been affected. Because we have an increase in the number of confirmed cases to enhance protection for patients and staff, HA will enhance testing of staff members. Starting from next Monday, staff that are responsible for taking care of high-risk patients, they will have to do daily RAT and 2 additional PCR tests per week. Chemotherapy, radiotherapy, oncology, organ transplant, renal dialysis, and also psychiatric wards. The hospital will give them sample kits, so they have to provide deep saliva samples for return to hospital. Because PCR is more sensitive, it can provide additional protection to staff so that we can effectively identify cases of low CT value or of low viral load, and then we can lower the risk of infection. For the RAT requirement, they remain the same. All staff will have to conduct an RAT before reporting to work and report results to the hospital. And may I remind the public that the epidemic is on a rising trend and we should all remain vigilant.
It's now time for questions. Please raise your hands and wait for the microphone. Before putting questions, please identify the organization you represent. TVB. Barclays International Kindergarten, the infection, the transmission in the school bus, for the 4 cases, are they from the same class or different classes? For these 4 cases, do they take the same school bus or different school buses? And for the route of transmission and the source, is it the case that the students pass it on to the nanny or the driver or the other way around? Now, for these 4 students, have they all used the school buses? What is the route of transmission? Also, for home quarantinees, they have to wear the electronic wristband. For those who declare their infection, will they be given the wristband? And if not, how soon would they receive the wristband and how soon would they get to use them? And how many, what quantity do you distribute? And for the Shenzhen Bay port, there is a new policy whereby the COVID positive departing passengers will be sent to quarantine. How many have been sent to quarantine for quarantine, sent to Penny's Bay for quarantine? And for those who test negative, would they be allowed to go home? For this international kindergarten, there are some school bus driver who tested COVID positive, and the drivers drove many buses. Bus number 18, there are 2 students who tested COVID positive, and on board the bus there probably was some transmission, and there are 26 students who will stop going to school. They are from different courses. At the moment, we haven't seen any suspected transmission in other courses. Now, for the newly declared positive cases, the OGO will make the arrangement for them to be delivered the supplies, kits, and also the electronic wristband. And they have to wear the wristband themselves. As soon as they are or they test positive, the information will be passed on to the OGO for them to arrange for the delivery. And all the COVID positive cases will see such arrangement. You mentioned the quarantine center. There are a couple of them from the Shenzhen Bay port and some from the airport who were sent to the quarantine center. I don't have the precise number though. A lady at the back over there, please. Cable news. Now for the Kowloon Tong kindergarten, there is one driver and some nannies who got infected. They had meals together. Which restaurant did they have meals in, and where is the source of infection? Did the bus driver take any other students or from any other courses? Now, do you have the number of quarantinees who are wearing the electronic wristbands? And for those who test positive at the boundary control points, they are not serving home quarantine, but those who test positive in the community, they will be serving home quarantine. Will you be allowing these departing passengers who test positive at the boundary control points to serve home quarantine as well? At the BCP, if they test COVID positive, they will be waiting at the designated isolation zone, and then they'll be receiving the isolation order, and they will be sent to the Penny's Bay community quarantine facilities. And there we will conduct a PCR test on them. There are some who may be re-positive cases. We will have a look at the test results. If they are re-positive cases, they will be allowed to leave the facilities. It will be the same arrangement for those who are picked up at the airport and also who are picked up at the RTD arrangement. We will make such arrangement for them to be sent to quarantine center at Penny's Bay. Now for this St. Catherine International Kindergarten, the driver will be driving different buses, and in one of the buses there are 2 students and a nanny who tested COVID positive, and there could have been some transmission on board the bus. We haven't picked up any transmission in other classes or in other buses. Probably there was some community transmission, and the drivers themselves would be eating together, and that could have been a scenario where there was transmission. Lady at the far end, please. Mingpao Daily. Dr. Ho for QH, the orthopedics, saw a cluster. Is it in any way related to the previous one? And also the deceased person from the Buddhist hospital, did the patient die of or die with COVID? Who got infected first? Was it the staff member who brought the virus into the ward? And the staff members will have to undergo a PCR test for the staff members in other wards. How can you guard against any in-hospital transmission and outbreak? And recently, the number of staff members who come down with COVID seems to be creeping up. Do you have the latest numbers? And in terms of the level of services, is it really affected? Dr. Chuang, today, how many people are serving home quarantine? Do you have the numbers there? And from the RTD operation yesterday, there is a block with a positive rate of more than 3%. Now, in terms of the sewage surveillance and RTD, do you have any numbers regarding the number of positive cases that you can update us on? Right, sewage surveillance and also RTD, we have seen a number of blocks that have higher number of cases. Even for sewage surveillance, we are seeing a sign of increase. So it is reflected on the caseload and also on the hospitalization. The number of cases is actually creeping up. QEH, orthopedics ward, the number that we announced today is a different orthopedics ward. Now, for the Buddhist hospital, the lady patient, the CT value is actually 33. We are still looking at the situation, and there is a test that came back positive, and we have already started the antiviral pill on her. As regards the source of infection, we're still contact tracing for that particular ward. The patients left the hospital, and there was some compassionate visitation in the ward. So we are still investigating the case. In terms of staff members, there were 59 staff members who come down with COVID. The number of infected patients is standing at 25,053, and 23 have come back to work, and in total, 24,613 have already returned to their posts. And that's why the hospital authority staff will have to undergo the RAT test every single day. It's only with a negative result that they can turn up for work. For the high-risk patients, if the staff members are looking after these high-risk patients, as we said earlier, we would increase the test starting from Monday. Those who are looking after the high-risk patients will, other than the RAT daily test, they will have to undergo 2 PCR tests on a weekly basis. PCR tests are more sensitive. The whole idea is actually to increase the protection of these high-risk patients and also to minimize the chance of transmission inside the hospital. We are monitoring the situation at the present moment. In terms of numbers of the staff members, we can manage with the current situation. Thank you.
Next, the lady in black in the front. Good afternoon. With regard to the RTD of Fuhang Estate, 34 positive cases have been picked up. Dr. Zhang, do you have any information on the distribution of these cases? Are they on the same floors or same orientation? Any vertical transmission? And what is the CT value of these cases? Are there any positive cases? If so, the percentage, please. And a question for Dr. Ho. For the case who passed away today, so for those, what is the difference between having 3 jabs, 2 jabs? And for the one who passed away with no vaccination record, was she suffering from any chronic disease? Yes, for the case with 34 cases in an RTD, 23 families are involved. We do not see any vertical transmission. Probably is a transmission by through the environment. the case with 3 Japs, a 64-year-old from Buddhist hospital. This female patient had a tumor metastasized to her lungs. So, as we all know, she was in the palliative ward, so she was frailer, and then unfortunately she has passed away. Next, this last question. I'm from Now TV. Good afternoon. Some legislators are of the view that for those who have received the quarantine order at Shamjan Bay Port should be allowed to serve home quarantine. What is your view on that? And I'd like to know the time taken for declare cases to receive the electronic wristbands, and the number of cases from schools remain to be high. What is your view on that? Well, the number of cases from schools on par with the percentage in the community. Sometimes the figures fluctuate, and for some classes, suspension for 1 week is advised. We haven't seen a major outbreak in schools. The daily RAT has been very effective in preventing outbreaks in schools. And as for the electronic wristbands, I know they will be delivered as soon as possible, although I do not have an exact answer. For daily cases reported through the declaratory platform, will pass these cases to OGO as soon as possible, and they arranged for anti-epidemic kits, including the wristbands, to be delivered. OGO will confirm the activation of the wristbands, etc. What about supplementary information on Shamjan Bay Port? Well, this is similar to the arrangement of designated testing places. We need better risk control, so they require to be quarantined at community quarantine facilities. But as soon as they're admitted, another PCR test will be conducted. And if it is a positive case, then the quarantine order will be removed. Thank you very much. The press briefing ends here. Speaker was off mic. I don't have the exact figures.